So imagine a patient walks into your clinic with a weak, immobilized arm after the cast comes off, looking more like a noodle than a muscle. That's atrophy in action, and it's a key topic for USMLE Step 1. This slide kicks off our USMLE High Yield Bites series, diving into a cellular injury, atrophy, metaplasia, and dysplasia. Stick with me to master these concepts and ace your exams. Alright, now let's zoom into the atrophy. It's all about a decrease in tissue mass because cells shrink or their numbers drop. Think of that noodle arm. The mechanisms here is first the cytoskeleton degradation happens through the ubiquitin proteasome pathway or autophagy, basically breaking down cell structures. Then protein synthesis takes a hit, and in some cases apoptosis, which is a cell loss, kicks in. Causes are super common: disuse like that immobilized limb, denervation from the nerve injury, loss of blood supply, or hormonal stimulation like in the menopause, or even poor nutrition from malnutrition. The key point here is atrophy is an adaptive response to reduced demand, and the good news is that it's reversible if you tackle the cause. Perfect for those USMLE vignettes where you spot the trigger right away. So now let's switch our gears to metaplasia and dysplasia. Cell makeovers gone wild. Metaplasia is stem cells reprogramming one cell type into another to handle the stress. Think about the Barrett's esophagus, where gastric acid turns esophageal tissue into intestinal epithelium, or smoking swapping respiratory ciliated columnar cells for stratified squamous. Even connective tissues can turn into bone post-trauma like a myositis ossificans. But watch out, persistent insult can push metaplasia towards dysplasia, a pre-cancerous growth. Dysplasia is disordered, not adaptive, with features like pleomorphism, lost tissue orientation, and nuclear changes. Think about the higher NC ratio and the clumped chromatin. Progression, mild to moderate, is reversible if the cause is removed, but severe can lead to carcinoma in situ or cancers. A key point is, it often follows persistent metaplasia or pathological hyperplasia. Nail these for USMLE Step 1, like and subscribe for more high yield bites.